And good morning again. No new developments on the Ebola crisis overnight. A cruise ship carrying one of the Dallas hospital workers who handled Thomas Duncan's lab specimens has been returned to Galveston. That worker is still being monitored but shows no signs of virus. At midnight tonight, a quarantine on Duncan's family and friends will expire. Texas Health Presbyterian, the hospital where Duncan died, and 2 nurses were infected, took out a full-page ad in local newspapers today apologizing again for their handling of the Ebola situation and for the mistakes that were made in not diagnosing Duncan initially. We start this morning with Dr. Anthony Fauci of the National Institutes of Health. We keep hearing reports that the CDC is about to issue some new guidelines here. Right. Can you tell us anything about that?
Well, I don't want to preempt the issuing of them, Bob, but we've been working with a set of guidelines that have been modeled after what has been done for many years by WHO, that we want to make sure we go a step further with that. I can tell you what we do today at my institution is predicated on no skin exposed, good training, having somebody monitor you back and forth to make sure you put your garb on and you take it off. Well, that's what we do. Don't want to officially comment on what's being developed, but pretty soon we're going to be seeing new guidelines that at least I can tell you they're going to be much more stringent than the previous.
Much more stringent.
Yeah, in the sense of instructions about what you really need to do.
I talked yesterday with the head of the Texas Presbyterian Hospital where this man died, Dr. Richard Vargas. He told me he still does not know how these 2 nurses became infected with this. But he says the CDC guidelines were, in his words, insufficient. Have they been fixed now with this new set of guidelines to your satisfaction?
So let me explain. I know this sometimes gets confusing. The guidelines that were originally on the CDC were WHO guidelines that worked very well for many, many years in approaching patients who have Ebola in the African setting, which is in a much less well-developed setting, not the tertiary care. Now when you have patients here, we do things that are much more aggressive with patients, intubation, hemodialysis. So the exposure level is a bit different, particularly because you're keeping patients alive because you have the capability. So those guidelines had some aspects about it that we're going to improve on. For example, the guidelines did have some exposure of skin in the sense you had a mask, but there was some skin that was exposed and some hair that was exposed. That's the thing that now in our setting of tertiary care, we want to make sure that that's no longer the case, that you have essentially everything covered. So when he says he doesn't know, yes, that's true. We don't know. But we do know that they were in a situation where there was clearly an identifiable potential for how they got infected.
Well, I mean, that's the part that, as a layman, that kind of bothers me, that all this time has passed and they basically, what he says, they don't have a clue.
Well, again, I don't want to be...
That's my word, not his.
There's no definite, because you can't say that she definitely got infected here, because remember, she went from a less stringent to a more stringent protocol. She was not only on the original protocol. As soon as they found out that this person was positive by the lab test, then they switched over to a much more stringent protocol. So he's right that you don't know if she's infected here or she's infected in the more stringent protocol. But I think common sense would tell you that it's much more likely that you get infected when there's skin exposed as opposed to when there's not skin exposed.
Is an Ebola czar, the president appointed Ron Klain, who had been a chief of staff to Vice President Gore and then later to Vice President Biden, to sort of take charge of this? Is that going to help?
Well, it's going to be coordination. It's going to be Ebola response coordinator. We don't call him a czar. He doesn't want to be called a czar. It's the Ebola response coordinator. And right now, since you have multiple agencies working very well together, that coordination has been handled extremely well by Lisa Monaco and by Susan Rice. but they have very important day jobs too. So what you need is the coordination, and Ron will be doing that on a full-time basis.
You don't see this as something that should have a healthcare professional in charge?
Not necessarily. There are health officials. There's myself. There's the CDC. There are others. You don't need to be a healthcare person. You need to be somebody who's a good organizer, and his experience is extraordinary. He's been chief of staff to a couple of vice presidents. He has a lot of experience.
Let me ask you this. A lot of Republicans and now some Democrats are demanding a travel ban on people coming from Liberia. You are a health professional.
Right.
Does that help? Is that a good idea?
Well,
could it make a difference?
Well, first of all, we certainly know that the people who think about that and suggest it are people of good faith who really feel that that is going to help. And we feel that there are some downsides that could be counterproductive, that if you do a ban, that you then lose the direct control of knowing exactly who's coming over, so you'll be able to track them. That's one of the disadvantages. But it isn't like they are completely wrong and don't know what they're talking about at all, because it's a reasonable thing to propose. We just happen to think that the downside is probably more than what the upside is.
Dr. Fauci, we wish you the very best. This is a tough one. Thank you very much for
Thank you.
joining us.